Here we are going to talk about the obsessive compulsive disorder, shortly called OCD. So you see the OCD or obsessive compulsive disorder, there are two components together. One is obsession, other is compulsion. So if you repeatedly thinking same thing again and again, and you are doing something again and again because of your obsession, right? Why you are doing this? To reduce your anxiety. Why anxiety come? Because of your obsessive thinking. Abnormal thinking repeatedly come, and you doing something repeatedly to reduce your anxiety. So let me give you an example. Like you are came from the outside and you think the COVID-19 is in your hand. At home, you wash your hand, it is okay. One time, two times. But if you wash your hand more than 20 times, definitely it is obsession. Why are you washing your hand? Because you thinking infection or still touch your hand and you washing. So abnormal thinking lead to anxiety, and you washing hand means you're doing something to reduce your anxiety, right? So when you do something again and again, it impact on your daily life. So let me read it. Obsession called preoccupation with persistent intrusive thought and persistent intrusive ideas. And compulsion means performance of rituals or repeated behavior designed to prevent some extent or divert unacceptable thoughts and decrease the anxiety. Like today morning, you get up, wear your dress, and you ready to go your office. You close your door, but you feel your door is open. You again come and again check. So if you check more than 10 times before to start to go to office, and if you do same everything every day, definitely is impaired your performance. It impact your office time. You will be late to get in office, right? You checking the door again because you thinking it is open, right? So the problem in the thought or problem in my ideas. Obsession and compulsion often occur together and can disrupt normal daily activities. So usually OCD patient has persistent thoughts or urge that cause the anxiety. The patient engaged in compulsive or obsessive behavior, like frequent checking the light turn off or on, frequent checking the door close or open, frequent hand washing. So this behavior to alleviate the anxiety or rituals are time to consuming and limit time for other activities. So patient adhere to a rigid set of roles, and definitely it impact their daily life. Hmm? So now go here. Anxiety occur when one resists the obsession or compulsiveness. So like if when you will deal with your patient, if they have this problem, it is good, don't interact with them, don't forceful them to stop their obsession or compulsiveness. You have to be deal very technical way. Like I'm washing my hand every 5 minutes. You are my RN. You tell me, can you tell me why you are washing your hand? Means you give the space to verbalized. Then you have to listen. When you listen me, next you can say, okay, this time you wash your hand after 5 minutes. Next time you could wash after 20 minutes. So you give them some condition. It can reduce. But if you say don't, you are not allowing to wash your hand again and again. So you resist them. Why they washing their hand? Because of anxiety. And when they wash the hand, they feel their anxiety is reduced. The psychiatry patient basically innocent, right? So don't go fight with them. Any kind of argo is not a good. So obsessive thoughts can involve issue of violence or aggression or sexual behavior, orderliness, or sometimes religious. Hmm? So next here. So some obsessive type of problem here. You see in the picture, the man is washing the hand again and again. Or this lady in the picture, hair pulling disorder. She all the time may be doing like this. So some obsessive compulsive related disorder, some of the example are holding disorder. Holding disorder are the disorder characterized by difficulties in partnering with, or it is the discarding position, or sometimes skin picking disorder, substance or medication induced obsessive compulsive disorder, or obsessive compulsive and related disorder due to the another medical condition. And last one is hair pulling disorder. Now let me explain little bit what are the nursing care and what are the treatment option. So compulsive behavior pattern decrease the anxiety. So it is good. Do not stop directly their activities. The patterns are associated with obsessive thoughts, and the pattern neutralize the thoughts. During the stressful times, the ritualistic behavior increase, or defense mechanism include the repression, displacement, or undoing. So what are the treatment option? So always it is we have keep it mind. So help your patient set time limit for compulsive behavior and lengthening the time between the rituals. And also some psychotherapy can work. Psychotherapy including cognitive behavior therapy, like exposure and response to the therapy. And cognitive therapy to help the patient identify the source of anxiety and that lead to compulsive behavior. So when you talk to the patient, be friend with them, make a trustable relationship, give them space to verbalize their feelings, and you have to be a good listener. Then they can tell their story, right? Although the story is not related to reality, but when you listen, they thought you are giving them importance. It is a part of psychotherapy. So, and when you listen, or if you identify their anxiety that lead to compulsive behavior, and definitely it will be reduced. And also thought stopping to interrupt the obsessive behavior. Then go for medication. Usually we use SSRI like sertraline, selective serotonin reuptake inhibitor, or SNRI, both works. Or sometimes we give anti-anxiety medication, right? Like benzodiazepine, lorazepam,